Yeah, I mean, first of all, I think there's no doubt there's a clear consensus on the part of everyone involved that it was absolutely imperative, I think, that the response to COVID-19, in terms of both its size, its scope, and its speed, that the response needed absolutely to be commensurate with the unprecedented magnitude of the crisis. I don't think there's any doubt about it. We had to be fast and we had to be decisive and respond massively. That's what our stakeholders expected, and that's also, quite frankly, what the communities we serve deserve to deal with the pandemic. So this has been the plea, the urgent plea to the World Bank and to all international institutions, to bilateral donors and to individual governments. Therefore, I think in response to that, you have seen effectively a massive spending, and we've just talked about what our institutions are doing. And let's not forget, we're not the only game in town. There is also a lot that's been done by individual countries, their governments, bilateral donors. So it's quite been a significant scale of spending. Now, when you have that kind of massive spending, and in most cases, we've seen that it had to be dispersed quite fast in order to respond to the immediate needs. And the third element is, in many countries, as you know, there have been exceptional emergency measures at the country level, including in some cases quite significant reductions in various oversight and safeguard mechanisms that used to be in place in normal times. So I think the combination of these factors, massive spending, fast-track spending, exceptional emergency measures resulting in reduced safeguards, when you put all this together, that's why I refer to it as a perfect storm for potential fraud and corruption. And I think we have to be mindful of it, even though the risks may not have fully materialized in many cases yet, but we need to be mindful of it. And I think the risks are, we all know what those risks are in the context of the pandemic, whether it's around procurement fraud, bribes and kickbacks, potential embezzlement of funds, which is quite possible, even counterfeit products with potentially deadly consequences, which is often an issue in the health sector and emergency operations in the health sector. Not to mention, actually, the petty corruption in the enforcement of measures and the like, which does erode public trust and actually undermine the implementation of the response mechanism. So I think all of these things can have a significant impact in terms of the effectiveness of the response. And that's why I think that in order for the response to be effective, it is absolutely crucial that we think proactively about risk mitigation.